Welcome to the Wellness Rebel Show, where you reclaim your health and tap into your body's healing power. I'm your host, Fatima, here to empower you with the knowledge and tools to take charge of your well-being. Whether you want to boost energy, improve mindset, or unlock vitality, this is your go-to source for practical advice and inspiration. It's time to step into your power and live a life of health and freedom. Welcome to the revolution. Welcome back to the Wellness Rebel Show. Today I have Perrin White. She's going to talk all things mouth breathing and myofunctional stuff because we need to make sure that we're breathing correctly for us to live a truly healthy life. Welcome, Perrin.
Oh, thank you for having me, Fatima.
All right. I just go ahead and share your journey on how you got here, right? Like, how did it all start? And now that you're here,
Yeah, well, it's like, how do you give the abridged version? I would say, in a nutshell, I didn't breathe well my entire life and my entire young adult child. And when I say wasn't breathing well, it's because I was mouth breathing and not like gaping mouth open, but always just a little bit. And from there, mouth breathing during the day translated to mouth breathing at night. And essentially, I spend plenty of time in bed, but I would never get enough quality sleep in that said bed. And ultimately ended up getting most likely to fall asleep during graduation for my high school superlative. What I think's funny is that we thought it was funny, but really it's a cry for help. And when cries for help aren't recognized, you just keep trucking along. And so then in college, I was diagnosed with ADHD and given Adderall. And I thought, great, I have this little pill that keeps me awake and I can do anything and I don't have to feel anything. And also, meanwhile, my parents were getting divorced. I was away at college. I didn't know it then, but utterly depressed and couldn't get out of bed. So you give me this great little band-aid that then lasted 10 years. And that was all the way through graduate school where I ended up becoming a speech pathologist. And so I graduated from graduate school and found myself just miserable, like, just completely dependent on this medication. And I'd gotten so far from who I was because the thing that was supposed to fix the fatigue really was in itself just a whole nother beast that had to be tackled. And the hard part is when you get so far from what you need and who you are, which is a person that needs help breathing. It makes it really challenging. So after getting off Adderall, which honestly it'll be 10 years next year, so that's always interesting. I was taking Adderall for 10 years and it's almost 10 years since I've taken Adderall. It's taken a long way to basically get rid of the Band-Aid. I'm doing air quotes, the Band-Aid, so that I could actually tackle what was happening. And what I know now and what I treat now and what I've been able to treat in myself and now provide that information to others is I assess mouths, specifically tongues, for their speaking, their breathing, their swallowing. And then I look at noses and make sure the nose can work, that the septum is straight, that they can breathe solely through their nose, that they don't need to go to an ENT. I teach people how to unblock their nose, how to use their nose. And we put it all together for breathing, for sleeping, for being, for meditating. What's really cool is I ended up having a tongue tie, a lip tie, a buccal tie. I had to get a deviated septum fixed. I had my turbinates reduced. I had my tonsils taken out. And that was all at age 34. So what feels really cool is when I have people saying like, oh my gosh, I've lived so long without it. I was like, I lived twice as long without it. And now I've fixed it. And I think it's really important to know what it looks like at every stage. And the hard part is you don't outgrow it. The symptoms simply shift. And what I'm talking about, it is being unwell. It is not breathing well. It is not sleeping well. It is breathing through your mouth. It is not chewing your food fully. It is feeling like burping or having reflux or bloating in your stomach is normal after a meal. And it's simply, how do I recognize what my body's telling me? then what do I do about it and how do I support it? So what I do now is I am a speech pathologist. I'm a certified oral facial myologist. I'm a registered yoga teacher, breath coach, and I actually just got my craniosacral fascial therapy training certification a couple of weeks ago, so I use that now. But basically, I fix people's breathing, and I had to fix it in myself first. And what I love is you can go the spiritual route with more meditation and mindfulness. You can take the more scientific route, looking at anatomy and physiology. And sometimes, aka most of the time, we need a combination of that. And that's what I do. That's what I provide. I do that for ages 3 all the way to 300 if we could make it. So the lifespan, as long as you're breathing, as long as you have a mouth, as long as you have a tongue, I can help you. And I do that daily through my individual clients, as well as what I post on Instagram, as well as what my family is probably so tired of hearing me say and talk about. But anyone that will listen, I'll talk to them about the importance of nasal breathing, tongue rest posture, recognizing the signs of a tired body, a sleepy body, a body that's not breathing well, so that you can actually address it wherever you are.
First of all, congratulations
Yeah,
to
thanks.
10 years of being
Yeah,
off Adderall and 10, no, not 10 years, and the craniosacral fascia therapy certification.
thank you. Yeah, the CFT Gillespie
Yeah.
approach.
I
Yeah,
love that. Yes.
that is so cool.
Yeah. I'm so sad. So I had one practitioner that would drive all the way from Sacramento to me because we live in the middle of nowhere. I
Yeah.
would just had to pay extra for her to drive here, but then she stopped doing it. And I was so sad. I'm like, I can't find anyone else.
Well,
But
maybe you take the training yourself.
yeah, right? Yeah.
Yeah.
Yeah. I heard that they do that and you can just do it on your own kids. So
Yes.
we'll see. It's just when we drive 2 hours and do a training with everybody with me, it's hard.
Yeah.
So, yeah, but that's amazing. Your
Thank
clients, the in person clients, are so lucky to be able to have access to that because it's definitely, to me, it's a very powerful add on, like
you.
the
Yeah.
whole fascia. It's amazing.
Well,
So, go ahead.
I was gonna say, and just realizing it's your whole body's connected.
Yeah.
Like your head's not separate from your neck. Your neck's not separate from your core, and your core's not separate from like your legs. There's connection to all of it, and the better you can understand it and comprehensively combine it in a way that feels meaningful, intentional, like it's better results for everyone.
Yeah. Yeah. But I have a question. So who
Yeah.
introduced you? Who introduced you to, or like, like mentioned like, hey, maybe you have a tongue tie, or like how did you find out that, like that was
Yeah.
kind of the issue, was the mouth breathing and the ties that's like
Yeah.
affecting, your health.
Absolutely. So my father is a dentist. He's retired now, but he was really instrumental in the field of dental sleep medicine. And I knew what the word sleep apnea was before ever I knew what the word was, I'm familiar with it, but I didn't know what it meant. I didn't really understand it. And I'd watch him go to courses and trainings, and he actually addressed all these issues in himself as an adult. And I'm watching him, and I'm learning what myofunctional therapy is, which is what I got certification in later on. And I've taken the 4-day course twice. The first time I was still woefully unaware of what was happening in my body. And I thought it was all bullshit because I couldn't do it. And lo and behold, I just wasn't able to recognize the dysfunction in myself. And
Yeah.
that's a really hard lesson that I'm grateful that I was able to learn. But essentially, I heard my father talk about it. And then I sought out education on my functional therapy. And really, it took a while between the initial introduction to that to realizing this is why it's not clicking, because I'm not functional.
Yeah.
I'm not functional. And it was slowly the combination of I I couldn't breathe well through my nose. I couldn't breathe well through my nose, and I kept getting strep throat. And so I went to an ENT as I'm learning about all these things. And he It's like, yeah, you have a deviated septum, your turbinates within your nose are inflamed, and your tonsils are huge. You keep getting strep throat. This is affecting your quality of life. So as a 34-year-old, I got the tonsillectomy, the deviated septum fixed, and turbinates reduced. And when I was finally able to take a complete breath in through my nose, I mean, I had tears in my eyes. I was like, I've gone 3 decades without breathing functionally. What else was I wrong about? And it really was slowly understanding I had it wrong. What else? I had this wrong. What else did I have wrong? And then that it just allowed me with curiosity to actually look at my tongue and look at the things that I'm trying to teach others and understanding this is why it's not connecting. And even after I got the tongue tie release, it really wasn't until I started taking myofunctional therapy seriously, pursuing a certification, and actually took the 4-day introductory course from the International Association of Oral Facial Myology again, that I was like, okay, now it's starting to click, and understanding that your tongue needs complete full range of motion. And your tongue is essentially your link to the back of your throat, which your airway and the soft tissue. And your tongue is what shapes your palate, which is the floor of your nose. So, of course, if your tongue is dysfunctional, what are all the pieces all around the web that fall as a result of that dysfunction? And so by being able to finally breathe, I then was able to look at my tongue and realize my tongue, and additionally my upper lip, my buccals, all those frenulums that connect essentially the tongue to the floor of the mouth, the upper lip to the apicularis oris, like these muscles around the oral facial structures. Being able to look with curiosity of, okay, I'm ready to see it and I understand it. And then even after you have the surgery, really it's the work of therapeutically unlearning and relearning how to use those muscles functionally, and then living it, and then doing it, and then seeing the changes that occur because of it.
Yeah, right. A lot of times I feel like that's the missing piece too. Like, oh, I'm just going to have the surgery and then not do anything else and
Yeah.
expect things to change just
Yeah.
because you got the surgery.
Well, and we were speaking offline about that earlier. I had a client that wanted to just do the surgery. She's like, I'll catch up with you to do some post-op exercises. I don't say not fortunately, but unfortunately, I've been doing this long enough that I've had clients that either have come to me because they had the release and they didn't have therapy and they end up needing another one after we do all this work. Or I've had a client that came to me but didn't really do the exercises, and then they report like little to no changes and they don't understand. And it's really both and. The body is always both and. The structure is only one part. Your behavior and the way you use those muscles is the other part. And then we're not even talking about the emotion that infuses the whole body, and that can cause all sorts of changes. But it's, to me, it's imperative. And the breathing, of course, I'm partial to it because that was my gateway. That was my point of entry, is like finally being able to breathe through my nose. And what I love about that is that allowed me to regulate my nervous system in a way that I'd never even been able to be able to breathe slowly in through your nose is how you ultimately shift out of that fight or flight and into that parasympathetic, the rest and digest. And honestly, if you cannot regulate your nervous system, if you don't have some kind of coping mechanism that allows your body to rest, it's going to be really hard to make the improvements and to make gains, because your body is constantly thinking, when's that shoe going to drop? When is that bad thing going to happen? And it can't give the emotional or even the physiological energy needed to heal your body because it's so wound up. But essentially, the surgery, and when I talk about the surgery, I'm talking about anything that's changing anatomy. So it might be a tongue tie release or a frenuloplasty or functional frenuloplasty. It might be an upper tie release. It might be a septoplasty, which is changing or fixing the septum within your nose. It could be a turbinate reduction. It could be a tonsillectomy. But essentially, we have to ask, why do we need that in the first place? And then, are we addressing that issue? And maybe it's part of the bigger picture. Maybe you have myofunctional therapy going as you're getting your deviated septum fixed, or whatever the guidance of your providers that that you're working with guide you in. But just know that it is not an either or situation. It is essential that you do both things. And I even recommend, like, I'd rather you wait on the surgery and keep practicing these functional behaviors before you go and cut something in your body, because your body is not going to know what to do with it. And I mean, best case scenario, you stay as is. The worst case scenario is your body like is hyper vigilant from that, and then more scar tissue comes to help stabilize this open wound.
Yeah, definitely use surgery as the last resort. I think, right?
Well, and it doesn't necessarily have to be the last resort. It's just the timing. The
Yeah.
timing is really important. And sometimes slash lots of times, you do need that surgical intervention to have successful outcomes and to reach your long-term therapeutic goals. But you've got to get the timing right. If you do it prematurely, the repercussions can be really challenging to try to fix and frustrating for both the provider and the client, because you're not able to reach those long-term goals. And ultimately, we don't want to put more harm or duress under, or put your body under duress than is needed or necessary. And we want to know how to heal and how to help care for that wound. And ultimately, when you get the timing right, and what I talk about the timing is like meeting the therapeutic criteria. So for example, for a tongue tie release, I want you to be able to suction your tongue and hold it for 3 minutes. I want you to be able to optimize a nasal breathing rate of 6 breaths per minute. I want you to be able to dissociate tongue movements from jaw movements and jaw movements from tongue movements, meaning can you stick your tongue out and elevate it without your jaw moving? And can you stabilize your tongue to your spot, which is directly behind your 2 front teeth, and move your jaw without your tongue moving? And both are necessary for swallowing, for speaking, and ultimately let me know you have strength, stamina, and support of those muscles, that musculature, before we go changing the anatomy, because I want you to be able to successfully transition to the new pattern that we've been working towards.
Right. I'm gonna pedal back a little bit because you mentioned strep throat. So do you find a lot of kids or humans that get reoccurring strep throat infections? Do you think that's mostly really connected to mouth breathing?
Good question. What I can tell you, I'll talk about myself specifically, and then I'll tell you my thoughts on linking it to others. So essentially, if I was always, well, not if, I was always breathing through my mouth, meaning I don't have any way to filter, to humidify, to clean the air. And so whatever's around me is going directly into my body. And then your tonsils are part of your lymphatic system. It's part of your body's ability to clear and clean and help heal your body. And if I'm giving it crap air, essentially, it's going to have a hard time doing its job. And then the interesting part is where the tonsils are is essentially the soft palate, the oropharyngeal space, and that's where the eustachian tubes essentially come right back in, and it's right here. And I don't know if your listeners are able to visualize this, but if you look like a slice through the face, you look at the back of the tongue, that red part right there, that's like at the back of your uvula, the very back of your throat, those are your tonsils. And if your tongue is not fully sealed up to your palate, then you're not able to fully develop these muscles of the soft palate as you grow and develop. And essentially, they're just prime for illness. You're not humidifying the air, you're not filtering the air, you're not getting the adequate gas exchange necessary when you get nasal breathing versus mouth breathing. So you're prime for illness, and you don't have good drainage of the eustachian tubes because your palate probably is not developing adequately because your tongue's not in the right place. Ultimately, then it gets into like the immune system, and then what's in your environment and what foods are you eating. So there's always a lot of factors, but I can tell you a pretty big one that contributes towards recurrent strep throat or just sore throats or colds is mouth breathing. That is your biggest line of defense, is to switch from mouth breathing to nasal breathing. This is how you clean the air. This is how you humidify the air. This is how you slow down your breathing rate so that your nervous system can actually regulate itself. And I don't have necessarily any studies that say that mouth breathing is directly linked to strep throat. But if you think about mouth breathing versus nasal breathing, when you open your mouth, you're essentially giving your tonsils direct access to whatever's in the environment around you. And then if you've got like allergies, or you find yourself allergic to pets or to dust or all those things, and they're around you, you've got to get some way to filter it out. And the nose is your best chance. And ultimately, strep throat is just your body saying, like, you really need to pay attention to your immune system and some really big things. And I would say, like, look at your food for inflammation, look at the way you breathe and the air that you breathe, look at the way you move your body and your sleep quality, because all those are going to contribute to either exasperation or amelioration of your strep and your tonsils.
So, yeah, I mean, I don't necessarily need studies.
Yeah, I was gonna say, I mean, just open your mouth and there they are. And then I think the challenging part is when your tonsils become enlarged, because ultimately they're sick. They're inflamed. It cuts off your airway. And that's the scary part, because you only have so much space in your throat, and tonsils can take up a pretty large part of that pie, that real estate pie. And if they are so big, you are left with such little space to breathe. So when you inhale, that negative space, that negative pressure pulling things in, that's when your uvula will get really elongated, because it's constantly being pulled down. And the uvula is that piece of tissue that looks like a boxing bag in the back of your throat. It's in between your tonsils. And so if that's really long, that's a really good indicator of mouth breathing, probably snoring. And think of it as negative pressures pulling that soft tissue. And that soft tissue is so malleable because it doesn't have any bone or structure to it. It's essentially just like all muscle, all fascia, all tissue. And there's all these signs you can look for that indicate mouth breathing. And a long, narrow uvula is one. Really large tonsils, that's another. Recurrent strep throat, that's another. And you can even look at the back of the throat. If it seems bright red, there's probably some silent reflux or GERD or just irritation in general. And no one wants to be irritated. Tissue, people, none of that. And there's just signs that if you know what to look for, they're there and they're evident.
How about, I know, you know how when you try to do myofunctional therapy, they kind of say you need to observe your child while they're sleeping and all that stuff. So if you can't observe your child, what are some like physical like symptoms that you can see that they are possibly mouth breathing at night while they're sleeping?
Right. Well, I mean, first off, you just look at them during the day. How are they breathing during the day? And what I guide parents on is like actually go in there when they are sleeping. So if you say like, I don't know, they're asleep, I'm asleep. I'm like, well, I need you to actually go in there and take a picture or take a video specifically of their mouth and look and see, can you hear them? Is it open? Is there drool? Are they moving? Do they have tornado sheets? Like, do they wake up during the middle of the night? Like, are they wetting the bed? Those are all things that happen during the night. Now you scan over to the day. I'm going to say the same thing, like during the day. And I say when they are zoned out, like if they are watching their favorite show, whenever they do have screen time, like what are they doing? What is their mouth doing? Is their mouth open? Can you see their tongue? Are they raising their shoulders to breathe? Like, I want to get those instances when they are blissfully unaware that you are watching them and they are just doing their thing, whatever their thing is, in their flow. What is their preferred way of breathing and of holding their mouth? Ideally, we want it closed. Ideally, we want the tongue lifted up. Ideally, we want good posture with the shoulders down, chest open, jaw unclenched, being able to breathe adequately with their diaphragm in and out of the nose. You probably, if you are If you're thinking there's an issue, it's probably because their mouth is open, their tongue is down low, or maybe even between their teeth. They probably have like a binky or their thumb or something that's preventing the tongue from elevating up to the roof of the mouth. What I would say too is look for elongation of the face. So just like that elongated uvula, in general, we want a wide and flat palate. That's the roof of the mouth that comes forward. If your child has a really flat mid face or their face is starting to look long, and what do I mean by that? I mean like eyes. Look at eyes. Like, are they starting to be tilted where the outside of the corners tilt down? Do they start to have mouth open? Does their head start to come forward? And what the body's doing this way is just trying to create space behind their tongue and their throat. And if there's no room because of enlarged tonsils or a tongue that doesn't fit the mouth because the palate hasn't grown adequately enough, or for all sorts of reasons, the posture then changes to make those accommodations to create more space in the throat. Another thing you can look at is their teeth, you know. So I've got this one little crossbite tooth here. So crossbite is when top teeth go behind the lower teeth. And this is really important, especially in children, because that lower jaw is then locking in the upper palate, the upper maxilla, the upper jaw from expanding. And in general, we want expansion. We want width. We want forward growth. And what happens in mouth breathing, tongue tie, and essentially that vertical breathing pattern is things get narrow, they get long, and that makes it really hard to be able to take a full breath in, for your tongue to fit into the roof of your mouth, for you to be able to rest your teeth and them fit with enough space. And so I have this one crossbite, and it's probably because I started my journey of myofunctional therapy and tongue tie release at age 34. And I've had oh yeah, you might have multiple sets of braces. I've had 2 sets of braces. I even had a permanent retainer placed on the top and the lower as an adult. My body popped them off. My body popped them off. And the body and the fascia and your patterns are really powerful. So the earlier you can start and notice, essentially becoming a detective, learning the foreign language of the body, and hopefully it becomes less foreign and more intuitive. But ultimately, we want lips sealed. We want nasal breathing. We want tongue fully suctioned up to the roof of your mouth. We want if you're looking at profile, you want ears stacked over shoulders, and you want to make sure that head is not forward, mouth is not open. We're not stressing to breathe. Like, we're not putting in effort. And I don't want to hear you. I don't want to hear you breathing. You are working way too hard to breathe if I can hear the inhales and the exhales. And then you could even get even deeper of like, how fast are you breathing? If you're breathing like you just ran a marathon and you're watching TV, that is a real 911 serious sign to check out what's going on with the diaphragm, what's going on with the nose. ENT is a great option. So as a myofunctional therapist, all those things.
Wow. Those are all amazing. Great way to figure out if there's a problem. Now, what do you think about, I know they're tools, right? And it has to be, you have to use them in combination with myofunctional therapy or whatnot, like the myo munchies and the myo brace. Are they great tools to help with the the muscles and all that stuff?
Yeah, I have Myo Munchie for myself, and a Myo Munchie looks like a sports mouth guard, and it has lots of sensory integration, like these little prongs inside of it. And essentially, it's a tool to help strengthen your jaw and support correct oral rest posture. And correct oral rest posture is tongue fully sealed up to the palate, teeth slightly apart, lips sealed, breathing in and out of the nose. And I literally was just watching this clip this morning, is something on the BBC talking about our food and how literally our food is soft. All of our food, if it's highly manufactured, if it's highly produced, is meant to be soft. And they were taking it from the side of, if you're not chewing, then your body doesn't get the information that it's full, that it's met its satiety. And what I know is if you're not chewing your food, then you're not using the muscles of your face. And that's, again, how you can start to create this long, narrow pattern. And I love Myofunctional as a tool to help strengthen the jaw. Now, a tool is not going to help you at all if it just sits there on the counter. So you actually have to use it. And Myomate, you actually have to use it. And ultimately, we're trying to shift behaviors and patterns. And when you're thinking about a Myomate or a Myofunctional, I would say that's when it's really helpful to at least get some guidance from a provider and have someone that can help you stay accountable, because it's really hard to be the parent and the therapist. So it's really helpful and worth your while to get a little bit of therapy to figure out what do you need, maybe even create like a maintenance plan if you're not fully sure there's an issue. Like, how do you just create and how do you just start healthy patterns? And then if there's a bigger issue and you're having difficulty with actually using the tool, that's when an orthodontist and palatal expansion, fixed appliances can be an option. Because if you can't use the tool, then it's just a piece of plastic. Otherwise, you need to look at some different options that the compliance factor out of it and are just built in, which is like a fixed orthodontia device.
I agree 100% because I'm having a hard time with my 8-year-old.
Yeah.
Because she's like, I'm drooling all the time, like all these things. And then I'm like, okay, I should present her that then, because she saw like the one from our dentist, the permanent, not the permanent, but like the one that's fixed where you adjust it with a screw. And she was like, no way. And so I was like, okay,
the rapid palatal expander.
I think, like the one that they like screw on and then you adjust it. And so I was like, well, the other option was, I know that ALF, right? It's like kind of just like a wire.
Yeah.
But the dentist was saying that sometimes it can push out like over here or something like that. And so, but that's a good idea though. I should present her that. Like, these are your choices now. If you want the easier one, but it will be like long term and have more compliance, then we really have to do it. Because then we're going to have to go this other way where you're like, she saw the pictures and she's like, no way.
Well, and you said she's 8 years old.
Oh, she turned 9 actually last month. I forgot.
Okay. So 9, you can actually have a conversation of like, what will be motivating? So choices are always motivating because you feel a little more empowered. And also, I remember going to school, like elementary school, and my parents told me, like, your job is to learn. That is your job. And that was like part of my chores, is like to get my homework done. And what I would say is like, okay, I'm not working for free. I get paid. So if my job is to do this work and I get this payment, great. Now let's carry it over to the kid. What are they working for? They are not, more than likely, they are not going to like really latch on to for the development of my face and so I can see. Like, it just does not translate. But you start making it really, really simple. So let's say, like, I need you to get your, we'll just say Myofunctional. I need you to use your Myofunctional 20 minutes a day for 4 out of the 7 days a week. And here's a chart. We're going to track it. After the end of this, you get like 30 extra screen time minutes, or you get like, I don't know, you get to decide, but like really start to think the language of that child or the language of the person that you're working with. What is actually motivating to them? Is it a trip to the zoo? It is an extra. My mind immediately said Beanie Baby, but I don't think Beanie Babies are cool anymore. But
she loves Beanie Babies. It's hilarious.
Okay.
Her bed is full of it. I'm like, you don't need more.
Well, but here's the deal. You figure out what you feel okay doing and then present her with choices. So maybe it is like, all right, are you going to do the fixed appliance or are you going to do the removable appliance? That is your choice. And then once you have the removable appliance, how do we set them up for success? And there's more work that goes into the organization at the beginning, but once you set your child up for success and you make it very clear and outlining of like, this is how we measure if you've met this goal and this is what you get if you do that, I guarantee you it's going to go so much smoother for you and the child. You have to speak their language, and their language is,
Yeah.
what do I get for this that's tangible, that I can see? And how do I know that I've done a good job, that I've met my expectations? Like, what even are my expectations? You have to make it very, very, very clear.
Great point and tips. Yeah, I actually kind of started doing that. Well, we didn't start anything yet, but I told her cuz she on her
Mhm.
birthday, she went with her dad and she bought all these little calico things. And then
Okay.
she came back, she's like, "I need more pieces." And she was adding it to my Amazon carts. And so I'm like,
Yeah.
"I'm going to use this." I'm like, "Each week when you have all the stars, then you can get one because I'm not going to buy it all for nothing, right?" And she
Yeah.
agreed. But, with all the traveling for the holidays, I'm like, "I'm going to start on Monday and remind
Yeah.
her about that."
Yeah. And also, it's like, how do you put more ownership in her hands? Maybe you give her like a blank, just Google chore chart. Chore chart image, go to Google Images, find a template, and then just plop in whatever you need, and then let them start keeping track of it. Like, set them up for success, and you have to make it in a language that they understand.
Yeah, yeah.
Yeah,
But so now let's move on.
sure.
Do you, because we were talking about the appliance.
Yes.
Can you like what are the advantages and disadvantages of the ALF and then the rapid expansion?
So what I can tell you is, if a kid is, well, just in general, from removable and fixed, if a
Yeah.
kid's not going to do it, a fix is going to be so much more helpful because it's actually going to be effective. Both are very effective, but they need to match the person that they're paired with. Now, as far as the actual appliances themselves, that's where the nuance gets in with the orthodontist. And what I can tell you, the ALF, I'm having a hard time remembering what it looks like, but I know a quad helix, which is also that light wire.
Uh-huh.
The quad helix goes around the perimeter of the palate versus a rapid palate expander, which has like a bar going across perpendicular to the palate, and there's a key that you
Yeah.
twist. So the quad helix, you can at least get your whole tongue elevated to your palate. I
Mm.
think it takes longer than the rapid palate expander, but the rapid palate expander works quicker, but you can only get the tip of your tongue to the roof of
Mhm.
your mouth. You can't suction your entire tongue. And
Yeah.
ultimately, whichever one that your orthodontist is most skilled in, that's probably, or whichever one they have the most experience with, that's going to be the best bet. But between the rapid palate expander and at least the quad helix, which is another light wire device, it really depends on the age. It depends on what you're presented with, like how much of a malocclusion, which just means how much of the teeth. Malocclusion just means the way the teeth fit together. Occlusion is a normal bite. Malocclusions when you have crossbite, or you have like teeth that are crowded, or when you
Mhm.
have teeth that are like inverted, or like complete overjet or underbite. All those things, it really just depends on what's happening. And I would talk to your orthodontist about it. And I would say, ask for case studies, ask for before and after, so that you can help make make a decision. But ultimately, if your kid's tongue can't reach the roof of their mouth, then they don't need to get the full thing sealed up there, but at least getting the tip of your tongue is helpful.
Mhm.
But if they can get their tongue sealed up to their palate, the quad helix or another one might be a good option, because then they can maintain that elevation of their tongue.
Yeah. And I feel so the rapid release, is it kind of like a surgical procedure sort of because they're like sticking something in there or
The rapid palatal expander.
yeah. Oh yeah, not rapid
No,
release.
it's not. I was gonna say, oh, that sounds cool. The RPE, the rapid palate expander, it's a device that's placed, but I think you have to go in more frequently
Mhm.
for the key, like the turn keys, or the parent themselves has to go in and turn the key. Essentially, it's like you're cranking it. It's like you put this
Yeah.
little widget in and then pull it forward or pull it back, whichever way it is, and that's turning the key. And it slowly, incrementally is creating more space in the width of your palate, that transverse palatal width.
Yeah, but
But it's not
how
a
do they put it on
procedure.
there?
There's some glue and stuff. Glue,
Okay.
that goes onto these back molars. And this is
Okay.
something that's interesting is like when do you put the palate expander? If they are
Yeah.
airway focused, if they're airway focused orthodontia, they will be much more inclined to do earlier. If they are
Mhm.
more standard, they'll probably say wait till the primary molars, the primary teeth have come out. That scares the shit out of me because you've missed a huge part of the craniodevelopmental phase that is instrumentally crucial to setting your skull, your cranium, your dento-developmental growth up for success. So, with that being said, choose your orthodontist wisely. Just
Yeah.
know if they are airway focused, they will be less inclined. I mean, age is always a part of it. And by all means, like, yeah, it matters where they are in stages of dentition. Is it primary? Are they permanents? And how many teeth do they have? You got to fix it to something. It has to say to something. But if they say like just wait until the permanent teeth come in and they don't really provide a pretty good reason why airway wise, I would say go to a different orthodontist.
Okay. Now, is it easy to find? Do they have like a directory for like
Mm.
airway focused, dentists that will make it easier for people to find them?
Yeah, I would say I don't know specifically of like an airway focused orthodontist, but I can tell you a couple of ways that I would recommend finding one is one, look at the Breathe Institute. It's by Dr. Zaghi. He's an ENT that integrates myofunctional therapy, and he has a directory of providers that um, he has taught or has taken his study. And I would say like just start there, like within your area is one of those providers, and then you just call them. And then I would also say I'm a certified oral facial myologist through the International Association of Oral Facial Myology, and that's the IAOM. They also have a directory, and I would go and just see what providers are in your area, and then you call
Mhm.
and ask them like, hey, what orthodontist do you like find the people that work with the people you need. And
Yeah.
I would also just start by talking to your orthodontist. Be like, what do you think about airway? What do you think the tongue's role is in the shape of the face? Or like, what do you think about tongue tie? I mean, oh my God, you ask about what do you think about tongue tie, and you'll probably get a pretty good response or a pretty good idea of if this is an airway focused or not
Yeah.
provider. And it's not that it's not that anyone's bad or good. It's but what are the goals? What are the goals of treatment? And if you're going for straight teeth, I think you're missing the point
Yeah.
of why the teeth are straight or crowded in the first place. But ultimately, you have to do a little bit of homework. But I'd say the Breathe Institute, I really like their directory to at least get started with providers, dentists, ENTs, orthodontists. And then for the support staff, or even like another way of finding those people is go to the IOM IS directory. And then once you find people in your area, just reach out to them and say, like, hey, what orthodontist do you prefer or do you recommend? And then also crunchy groups like Facebook crunchy groups. I try to stay off Facebook because it gives me a lot of stress, but you can also go that route and just ask for recommendations. That's really helpful. And then once you start finding holistic providers, you find a good body worker, they will know everyone. Like you find a really good like CFT or CST, which is craniosacral fascial therapy, craniosacral therapy, Rothing, all these like different modalities, a doctor of osteopath, like just start to find the people that work with these people. And I do know depending on where your audience is listening from, like sometimes sometimes it can be really hard to find the right practitioners and to find the right providers, and you might have to travel. But I'd say at least start trying to map out who these people are. And if you're looking at orthodontia, it wouldn't be a horrible idea to also look for some good body work. I like anything like I like chiropractic, but then that's a whole nother like umbrella because there's a whole lot of different chiropractors. But I really like craniosacral. I really like CFT. I like myofunctional therapy, and all these things ultimately are the consistent complementary practices that help the whole body get into alignment.
Right. How about, do you ever advise? I know you don't work with infants. You start working at 3, but
Yeah.
you know how because more and more knowledge about tongue ties and stuff, and then parents are like, oh, my baby has a tongue tie. Would it be beneficial for the infant to get their tongue ties released when they're little, or do you prefer to wait?
Yeah. I have a couple of, I'm just going to say thoughts.
Yeah,
I'm
yeah.
sorry. My dog is present and she snorts and she snores. Oh, don't
It's
tell
okay.
anybody. I've been trying to look at her tongue.
I know. I was gonna say she has a tongue tie.
There's something, I think it's in her nasal passages. Also, I think she eats too much. But honestly, I have thoughts,
Yeah.
and my thoughts on that is interesting because I think when I first started learning about it and actually taking it seriously, it's like, of course, you want to release. And I think there can be benefit in the infant being released, especially when there's a functional impact. And the tongue tie, it's never a tie if there's no functional impact. To
Okay.
me, there's always has to be some kind of functional deficit that's causing trouble or causing issues in the quality of life. Maybe it's the mom. Maybe the mom is having mastitis and the mom is having a lot of pain and she's not able to breastfeed and she really wants that connection. Yeah, get the tongue tie release with the support of a lactation consultant so that you can actually breastfeed. That is the functional implication. And that is a very real need. Maybe the baby's not sleeping well. Maybe baby is not able to eat. Maybe baby is choking or having jaundice and actually I'm not even sure. Scratch that because I'm not really sure. I don't know if jaundice is related to breastfeeding, but just understand like if there's a functional impact, yeah, you get it done then. But then I've also seen like 3 and 4-year-olds that had a tongue tie release as a baby, and I'm still like, God, that thing still looks tight,
Yeah.
tight. And so what I've realized is sometimes there's going to be 2 phases. Sometimes you need that initial release to get the functional support for that stage. And just understand that it might be needed at a later time when they are really able to start articulating sounds, and also when you're looking at swallowing and they're able to cognitively understand like a traditional structured myofunctional therapy approach, that there might be another release, another revision that's needed. So I want you to think about 2 stages of tongue tie as anterior, which is to the tip, really front forward, posterior, which is farther back. And I had a more posterior tongue tie, which is why it took 30-40 years to identify. If it is so far forward that it is recognized at birth, I guarantee you there's also a posterior component. So maybe you're getting rid or you're helping to alleviate the anterior, the front portion of the tie. That doesn't mean that you fully got it. And just be aware that you might need a revision later on, especially if when their teeth are starting to come in, if they're having gaps or they're crowding or just their teeth indicate that there's an issue. That lets me know that now we need to start looking at the behavior of the tongue, rest posture, the strength and tone of the tongue. You take a different approach. You always want to make sure you have functional support. You're looking at the functional implication. You're looking at more than just what does it look like, but how is that muscle? How are those I was going to say, how are those parts being used? And then what is the functional support before and after that we're looking at, and understand that it might change later on in the development. But I guarantee you, if you're looking at structure in addition to function and you're getting the support and you're doing the best job you can at that age range, I think it's still a benefit, especially if mom has less pain during breastfeeding, less mastitis, baby is actually sleeping, mouth is closed. And then it's almost like your car. It's not like you get the oil changed once and you never
Yeah.
have to do it ever again. Or it's not like you might not get a flat tire or you still have to refill it with gas. It's like, how do we maintain? And this is what I think is interesting with like nasal breathing. You have nasal hygiene routines. You clean your teeth. You go get wellness checks. Like, we have to maintain the health of our nose, the health of our airway, the health of our tongue. And we have to keep using it in functional ways, because we can develop really dysfunctional patterns because we're not aware or staying on top of it. And it doesn't have to overtake your entire life, but it's just checking on it throughout the duration of that lifespan.
Yeah. Yeah.
I was like, it's not a black and there's never, I
Yeah.
feel like with mindful therapy, it's never like a simple yes, no.
Right.
It's always nuanced. Every person is different. It is a both and. It is a gray world. And as someone that loves to think about thinking and talking and breathing, I love all of it. But just know that it's really hard to get those black and white yes, no answers, because it's all based on the individual. It's always based on function, and it's always nuanced.
Yeah. Yeah. No, I'm just wondering too, because if the baby, I wonder if in the beginning, if you're doing a lot of the like CFT,
Yeah.
because they
Yeah.
go through a lot, they still go through trauma, well, especially if they're stuck there for a while or whatever, or the
Yeah.
position they're in. So I want, do you think that getting craniofacial therapy or CST, when you discover that there's a tongue tie, that somehow that can kind of help kind of release that tightness
Yeah.
first before going to like surgery?
I would say in a perfect world, I would love everything to be sandwiched with functional support.
Yeah.
Any surgical intervention, functional support before, functional support after. Everything you're doing pre-op is to unlearn old patterns, prepare the musculature, help support the fascia for change, and then you actually make the surgical intervention, and then everything following it is to make sure it sticks, to make sure the new pattern stays, to make sure that the fascia is able to move, to make sure that the wound heals appropriately. And in a perfect world, I'd love every client to get as much myofunctional therapy as they can prior. I'd like them to get body work prior. I'd like them to see like a body work or their myofunctional therapy like immediately after the release, and then checking on it and get the body work that's needed after. But I know there's like time and
Yeah.
money and resources, and who do you go to? Are they even available? So you do the best you can with what you have. But I am continuously blown away by what the body is capable of. And as far as like the fascial work goes, the best experience is what I've learned on myself. And just from taking that course, I think like 2 or 3 weeks ago, I've just been doing it on my face, like following the fascial movements and releasing different strains. And I'm seeing my face change. It's wild to me. I'm seeing more symmetry. And granted, there's things like crossbite. I probably am not, despite how much I'd love, I'm not going to be able to like fix a crossbite with CFT alone. But
Yeah.
let's say I actually did do orthodontia again, a third time, it probably would stick because my body would be able to accept it. And this is not like a hard and fast objective, like you need X amount of hours with da da da, because everybody is different. Every nuance is, every functional impact is different. But what I can tell you is if you prepare the body for change, and then when you introduce that change, you solidify it with more body work. So before and after, you're going to have much, much better outcomes.
Yeah, I love that. Because it's not a one-time thing. There's no shortcut, right?
No, what I think is really powerful is there is no rush in my
Yeah.
mind. There's unless you're an infant with failure to thrive or you're like choking every night with severe sleep apnea, like there is never like an immediate rush of like cut that tongue immediately.
Yeah.
I would so much rather you wait on the actual release of your tongue tie and spend some time unblocking your nose, strengthening your tongue and your jaw, actually working on the fascial systems that are controlling all this and actually giving your body a chance to prepare the palate, in essence, for this new pattern to emerge and understand that everyone's going to need a different amount, but
Yeah.
at least starting that conversation, setting yourself up for success, understanding that to me, the actual tongue tie release is the least interesting part of the entire process. It's really like, where are you starting? Where do you want to go? What do you notice in your body? How do you identify and then remediate compensatory patterns? And what do you notice is working? What do you notice is getting better? And really being aware of those small shifts and changes. Like, for example, I know the first time I got some really powerful body work, I just knew that I always like to sleep on my right side, which is like my tight side, which is like also the side I like to, excuse me, my left side. Like I like to sleep on my left side. I like to chew on my left side. There's like some interesting
Mm-hmm.
asymmetry on my left side. All of a sudden, all I wanted to do was like chew on my right side. All I wanted to do was like sleep on my right side. And I was like, I've never felt that shift before. And I know that feels, or that might feel a little flip if you're not familiar with this, but that's huge. Like your body shifting its patterns and preferences so that you can actually get more symmetry within your body. It makes huge impacts.
Yeah. Our body is definitely, to me, our body is very intelligent and it knows what it's doing. And
Yeah.
the
Yeah.
symptoms are simply just the body screaming for help, right? Okay. Well,
Yeah.
I'm going to definitely have you back on because,
I'd love that.
yeah, we have more to talk about. But before we end this podcast, can you share either a favorite mantra or like a nugget of advice for anyone that's on, like looking for answers or on a healing journey?
Hmm. Yeah. My favorite one is it's a breathing and a mantra, a tapping mantra at the same time. So the the first part is a 5-word phrase. The second part is a 5-word phrase. And I want you to think about it as you're inhaling 1, 2, 3, 4, 5. So I want you to slowly inhale as you say the words for 5. And I want you to exhale slowly for 5. And the words that go with the inhale is I am here right now. And the exhale, I have all I need. And what I love about this is if you can inhale for 5 and if you can exhale for 5, that gives you a 10-second breath. And then if you do that same pattern for a whole minute, you've done 6 breaths per minute. And that will significantly shift your nervous system from sympathetic to parasympathetic. And so tapping your fingers together even gives you more of that bilateral stimulation. If you just think on your inhale, I am here right now. Exhale, I have all I need. Just give your body a chance to slow down and breathe, reminding yourself that you're present, you were here, you're not dead yet. There's things that you can do, and you have all these beautiful tools within you. You just get to tap into them and see what they can do.
That was amazing. I'm going to start doing that myself.
It's a
Yeah.
good one. I use it a lot.
Yeah, I love those. I love those 10 words total.
Mm.
It's amazing. It's a great reminder that life is beautiful and we're here to live it and enjoy it. And we just need to slow down and actually enjoy life.
Yeah.
Well,
Yeah.
thank you so much, Perrin, for joining me
Oh, thank you for
today.
having me.
She's going to be back. Don't worry.
Thank
Do you
you.
have everything's going to be in the show notes, but if anyone's interested in working with you or connecting with you, where can they find you or how can they reach out?
So I'm in South Carolina, so I can be your licensed speech pathologist if you're within the state of South Carolina. And if you're in Greenville, I can come to you for a travel fee. But otherwise, I can be your breath coach. And I won't be able to give you any diagnostic information, but I can certainly tell you that you need to go to so-and-so or help you find the right provider and at least help you learn how to breathe and start to get some functional movement. But all of that is accessible through my website, which is breathewell.info, and then you can click book virtual appointment. Also do discovery calls, which is a really great place to even figure out, what am I talking about? How does this apply to yourself? Am I a candidate? Which, if you have a mouth and you breathe, you do. You are, but look at my website, and all my contact information is there. And then I'm also really active on Instagram at breathewell, be well.
Awesome. Well, thank you so much again, and see you next time.
It sounds good. And also, can I take a picture of us? Is that okay?
Yeah.
All right, so let's not sleep. Thank you, Fatima. Yay, our eyes are open. Awesome. My eyes, like one of them usually.
Thank you for listening. If you enjoyed this episode and you'd like to help support the podcast, please click the subscribe button. Share it with others, post about it in social media, or leave a rating and review. To catch all the latest from me or suggest topics, you can follow me on Instagram at Fatima Pagtakan or at The Wellness Rebel Show. Thanks again, and I'll see you next time.